Okay, good afternoon, everybody. My name is Vince Cogliano. Oh, is this coming through? Okay, my name is Vince Cogliano. I work for the U.S. Environmental Protection Agency in the program that evaluates the health hazards that come from chemicals you find in the environment. It's not quite healthcare, but we do some things that are similar. We're trying to get into more evidence-based reviews, and I hope you'll at least find this interesting. Just like with the foods, EPA touches things that everybody likes. Everyone likes the environment, everyone likes to be healthy, and everyone should like, science. But the thing is, our science then later feeds into regulations. And if you can fight on the science, you actually delay when a regulation happens. So that's why science becomes a battleground. Now, on the bottom here is a risk assessment, risk management paradigm that the National Academy of Sciences first put out in 1983. And it was an attempt to try to separate risk management or political decisions from the science. So, oops, wrong one. Oh, there is, yeah. So risk management here is you compare different regulatory options and you pick the one. You do have legal constraints, political constraints, social considerations, economic considerations, and technical considerations. What can you actually do? How many parts per million can you get your arsenic down to in drinking water, and so on. So there are a lot of constraints in these decisions. They're not all clear. Sometimes you don't even have control technologies to get down to where you want to get to. But what they wanted to do was separate those kinds of decisions from the science of, does this chemical cause cancer? Does it cause neurotoxicity? Does it harm children? And at what dose levels? So that's what they outlined, this risk assessment paradigm, where the first thing you do, you look at a chemical and you say, what are the health hazards that this chemical might cause? Then you want to get dose-response relationships. So as the dose goes up, the response goes up, and you want to figure that out. Then you have people figure out how much of chemical is somebody exposed to. So how far up on the dose-response curve are we? You put that all together, and then that risk people are facing is what you put into risk management, so they can then decide, can we get this risk down, and so on. So that's the goal. That's the ideal of what we're trying to do. Now, what we do in our program is the hazards and the dose response assessment. Basically, everything deals with the chemical. It's a very different type of operation to go out in the field and measure how much arsenic is someone exposed to, how much PCBs is someone exposed to, and that differs across the country. So our local people in the regional offices or people in state environmental health agencies do that, but we provide them the chemical information, which should be reasonably similar across the country. Now, we have a 7-step process, which I think one I've heard before. We have a lot of public involvement, but it's structured, and it's not structured towards like patients or towards communities, but it's structured towards a larger stakeholder community. So what we do, we start out, used to just say complete a draft assessment. It would be reviewed by scientists in EPA. Then it would go to be reviewed by scientists in other federal agencies. Then it goes to a public comment period where members of the public get at least 60 days to review and send comments in. Then it goes to a peer review process that happens at a public meeting. We revise the assessment and have another review inside and out of the federal agencies before we finish the assessment. Now, several years ago, we were criticized that we just say we complete the draft assessment and we don't really have any guidance about exactly how we do that. And it was quite uneven. So we've been embracing systematic review, and it looks just like what you do at FDA. This, I think I could say, is the problem formulation. It's defining the question. Then we identify the pertinent studies, evaluate the study methods and quality of studies to get the higher quality studies, integrate the evidence for each health outcome, and then we derive toxicity values. We want to help the agency set how many parts per million in air or in drinking water, or how much do you have to clean up a Superfund site, to how many parts per million in the soil. So we derive what's called toxicity values, how many parts per million would be safe or without too much harm, and then we derive those using a lot of mathematical modeling. Now, our problem formulation, the National Academy of Sciences set up a nice process for us. We do a literature survey of secondary sources. So rather than look at thousands of articles to formulate the problem, we look at what does ATSDR say, what does World Health Organization say, what did EPA say 10 years ago, and you figure out what are the health outcomes you're going to have to look at. So you make a table of all the different health outcomes. Oh, I hit the wrong one again. All the different health outcomes, cancer, neurotoxicity, reproductive toxicity, and so on. Do you have human studies by ingestion, by inhalation? Do you have animal studies? And do you have in vitro studies of mechanisms? And you fill this matrix in and decide what health outcomes are we going to address in the assessment, and do we have a lot of data or very scanty data to do that? We formulate questions for systematic review and other key issues. For example, sometimes there's research that says rats are not a good model for human disease, and those studies shouldn't be looked at or should be discounted. So you have to look at all of those things as well. We do a literature search, and we typically do get like thousands of hits, and then you have to get those down to what's more like dozens or hundreds of studies that are useful for a particular assessment. Now, what we do, I think, is a little different from most other places that do systematic review. We need much broader literature search strategies. If we're going to, for example, decide whether trichloroethylene in drinking water or ambient air causes cancer, neurotoxicity, and other things, we can't just do a literature search on trichloroethylene, because trichloroethylene breaks down into certain metabolites. So you'd also want to, after you do your first cut, you find out what's the metabolism of trichloroethylene, and then you need to bring in those metabolites into your assessment. And so our search strategies become a little bit more complex, I think, because we're dealing with chemical transformations in the body, and you have to try to get at all of those things. A broader approach to evaluating study. It's not just a risk of bias, and I really like Dr. Goodman's presentation because there were one of the studies that had bias and external validity and variability. Bias is just one component, and a risk of bias tool that just says you got high bias isn't quite satisfactory in our purposes, because it could be a high bias but in one particular direction. For example, in epidemiology studies, if you have what's called misclassification bias, you're not quite sure if somebody's exposed or not. They use solvents, but you don't know if it's trichloroethylene or not. They use mothballs, but you don't know if it's naphthalene or paradichlorobenzene. You've got some misclassification. Some people you think are exposed are really not exposed. And so that tends to reduce your chance of finding a significant result. Well, if you just say I got a bias because they don't have the exposure well specified, you'd throw a study out. But suppose you have a bias that would tend to reduce the risk that you observe, but you observe a risk that's probably higher than what you observe. You don't want to throw that study out. So in addition to looking at whether there's a bias, you want to look at the direction of the bias, and maybe sometimes the magnitude of the result could even overcome most biases. There's a lot of older studies of arsenic in drinking water in places like Taiwan, where they observe relative risk for bladder cancer of 40 to 60-fold, but they didn't do a lot of adjusting for smoking and other things that might cause bladder cancer. But smoking only has about a 3-fold relative risk of bladder cancer. It can't possibly explain a 40-fold relative risk. So the presence of a bias there doesn't really harm your use of the study. So there's a lot of things we got to look at that I think takes risk of bias to the next level, and it becomes more complex. We have to integrate human and animal and mechanistic evidence. So if we want to determine if something causes cancer, it's not just our human studies, what do they show, but what do the animal studies show? And that's, I think, somewhat different from some of the other realms where systematic review is put in. And also we do the dose-response relationships. After we determine there's a hazard, we try to figure out what does the dose-response curve look like, so that at a certain level of exposure, what is the risk? And because the agency needs to set some kind of a quantitative standard of 10 parts per million in your drinking water. And how do they know it should be 10 and not 20 or 50? You have to do some dose response modeling. So we do all of those things. And we have to develop and improve our methodology while we still have a lot of assessments in the pipeline. We do multiple systematic reviews in a chemical assessment. Does this chemical cause cancer in humans? Does it cause cancer in animals? Does it cause neurotoxicity? Does it cause reproductive toxicity? Each one of those is a systematic review. So we do multiple systematic reviews, but we also have to analyze mechanistic information that says, if you see a response in rats but not in mice and you don't have human data, do you say we have a human response or don't we? We have to know whether we have good, basically use the mechanistic data to tell us whether the results are applicable to humans. And that's more the controversy than I think with the systematic review component. We're developing a handbook of procedures for doing our systematic reviews similar to the Cochrane handbook. What was that? Oh, we also do this in public. We have 3 meetings in this process. One in the problem formulation, we have a public meeting. We have a public meeting while we're developing a draft, and a public meeting before we release a draft for peer review. We have disclosures required. When someone comes to give comments, we ask them the first time they speak, financial relationships, and the extent to which their comments are reviewed by an interested party prior to submission. OSHA does that too. I don't think it's universally done, but it's I think a good thing to ask people disclose. IARC, where I used to work, just this year celebrated their 50th anniversary, and they have a quote that, in practice, scientific judgment can be distorted by secondary interests that interfere with the primary goal of pursuing science. So experts have to be chosen free of conflicting interests, and that's one reason we ask for disclosures. But there's other question: how do you get politics out of science? I think that was the initial title of the talk that I saw on the website, but that's not. But I did want to address this. So how do you get politics out of science? You can't get politics out of federal agencies because we're bound to deal with the public. We have to have public comment. We have to accept comments from everybody. We have to be fully open and transparent. But you reduce the role of politics by filling the space with science as much as you can. And so one way is to begin with a systematic process, make sure you get all pertinent studies, verify the studies you use are acceptable quality, and weigh the studies impartially through some kind of an evidence integration framework. Another is to invite the scientific community in early. So we ask people to identify studies we might miss. We ask for scientific comment on how we might evaluate studies to get all the perspectives. And it's not a vote of who speaks the loudest in a meeting, but you want to make sure you consider those. And now we're doing something very, I think, unique. We have a public meeting. We identify the topics a couple months in advance, and then we have a contract with the National Academy of Sciences, where we ask them to independently identify experts to come to our meetings. Typically, they invite about a half a dozen experts. They screen them for conflicts of interest, and they try to get a representative panel of people to represent all scientific interests. And they have now dominated the most recent discussions we've had at these meetings. The first type of meeting we had was before we had that kind of contract, because we couldn't do that under continued resolution at that time frame. And this was the distribution of, on the left, of the different sectors. The blue in the upper right quadrant and the orange in the lower right quadrant, that was industry and its consultants, about 2/3 of the meeting. Now that we're able to invite the National Academy in, that's the distribution. Industry and its consultants are about 1/3, but we have a larger representation of NGOs, academics, and a lot of people from state environmental health agencies or some other federal agencies. The most recent meeting on PCBs, we actually had 2 community-based NGOs participating in the discussion, one from a consumer group, a community group in California, another from a Native American tribe. The other thing to fill the space with science is to have rigorous peer review and have that peer review be in public. You're going to get a lot of conflicting stories, but at least people can say something and they can watch everything. So now we have a science advisory board committee that's dedicated to reviewing our assessments. The same committee reviews all our assessments, and I think that gives them a good sense of the types of problems. And so we've strengthen that process. So in summary, we're using systematic review, engaging with the public and especially the scientific communities for the National Academy, and we use a rigorous independent public peer review. So that's how what we do to keep science in the game. Thank you.